Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning, Robin.
So talk a little bit, for people who haven't heard you talk about this before, talk about these breakthrough cases, because I think people think they're vaccinated. Why am I still wearing a mask? How are these breakthrough cases happening and how frequent are they?
Well, they're getting more frequent, and this is why one of the reasons why the mask mandate is going into effect by Governor Pritzker, and why he's laid down the law now who's got to get vaccinated if they want to work in the state of Illinois, which is, I think, a very good thing. Now, there's more breakthrough cases, but they're mild or moderate for the most part. You look at the number of people in the hospital right now in Illinois, it's 2,184. And Robin, 96% unvaccinated. Unvaccinated. That is what's driving this thing. So the breakthrough cases are happening. That's disturbing. And now we're going to have booster shots for people 6 months after their second original dose series. So that's what's going to happen. So, breakthrough cases are happening, but they're generally mild.
Well, the number's obviously going in the wrong direction here, but you say that Chicago is actually doing better compared to the rest of the state.
Well, you have to have some good news every once in a while. The city of Chicago metrics are really the best in the state. So, they've got ICU beds available, they've got hospital beds, their rates are the lowest compared to all the other regions in the state, including suburban Cook County. Amazing.
Talk about this UK Human Viral Challenge study that's going on. You say, I don't want any part of it.
Yeah, well, I don't want to sign up. Okay.
What are they doing?
This started last year, actually. So they are recruiting people who are not infected, who've never been infected with COVID, and they are challenging them with COVID. In other words, they're exposing them to COVID, and then they're treating them or looking at different antibody treatments or vaccines or whatever. They're taking young, otherwise healthy people who typically wouldn't end up in the hospital, but they're even doing this with Delta virus. So, it's a very risky approach. I don't know if it could be done in the United States, frankly.
All right, let's get to some questions, starting with this. Why are we not doing antibody tests before giving people booster shots? Shouldn't we check to see if the boosters are needed before giving them?
Well, the reason is, there's a technical reason. The antibody tests that are available commercially are the wrong antibodies to measure. These are not the ones that are really going to predict whether you need a booster or not. So that's the main reason why we don't do it. Now, but it's a good question, though, because this is actually what we need. We need a cheap antibody test or some kind of test that will predict who needs more immunity. So it just doesn't exist today.
All right, next question. Is there any oral or nasal COVID immunization in the works rather than a shot? I suspect that a lot of people are afraid of needles. You mentioned this before. Yeah, I forgot about this.
Yeah, this has been going on for a while. So, there's like over 100 vaccines in development. And, we have a nasal vaccine for flu for people under 50 years of age. Sorry, Larry. I know he wanted the nasal one, but...
Look, and he's talking,
sure he's
Larry,
watching.
and he's not even here. I'm going to write that down.
Oh, you know that Larry's watching, though.
He's an old, you know what. You're right, Miss Dr. Murphy. Thank you. I'm going to cue this up for him.
No, they're in development. They are in development.
Okay. So how far away? Are we a few months away, a year away?
No, we're far away.
Oh, okay.
We're a year or so away. Yeah.
All right.
More.
I'll give you Larry's private phone number so you can call him directly if you'd like to. If you didn't get your question answered by Dr. Murphy, he answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or head to our Morning News Facebook page. Post one there. We'll talk to the doctor again on Monday. Have a good weekend.
Okay, have a great weekend.